is that somebody, probably near Ms. Reader, is going to hand you these 2 pieces of paper and is going to sit you down at the table, okay? And what I have here is an order. I have a doctor's order to start an IV for IV fluids, lactated ringers to run at 125, and then my Cleocin, clindamycin, 300 milligrams IV piggyback every 6. After I look it up, I know that it must infuse over 1 hour. Calculate the correct IV piggyback infusion rate using a pump. I have to look at my MAR to see how this is mixed. So I have Cleocin 300 milligrams and 100 mils. Since it says utilizing an IV pump, I know I'm looking for mils per hour. If it gave me a drop factor, I would know I had to calculate drops per minute. Okay, so I've got 100 mils over, it says that it must infuse over 1 hour. That's great. I hope you get that one. 100 mils an hour. I'm going to take that. You want to be Stephanie, you're the examiner, okay? You're checking me off. I'm going to show her my math. She's going to say,
good.
Thank you. Then she's going to, do you still do it this way? You still walk them over somewhere where they take out their medicine? Okay. Then Stephanie is going to say, come with me. She's going to walk me right here where there are these 3 bags. And she's going to hand this to me, because she's the teacher, I'm the student, right? She's going to say, show me which one you want. I'm going to look at my MAR. I'm going to look at all these, and I'm going to be careful, it's going to leak. I'm going to say this one. She's going to look at it and say, good. You're done now. Thank you, Stephanie. Okay.
What does that say?
Cleocin, 300 milligrams and 100 mils.
Okay.
When you get ready to practice, you can look at these or however you want, but look at the difference, Danielle. Look, that's 350, that's 250. I need 300 and 100, and I know that because it's what's on the MAR. Okay, so you have to pick the right medicine. Okay, now that I've passed the math, I've picked the right medicine, I'm ready to go in the patient's room. Okay. Okay. So. Hi, Miss Pearl. My name's Kim. I'm going to be taking care of you today. The doctor's ordered for me to start an IV line and then also to give you a dose of antibiotics. So can you tell me your name and your birthday? Good. And do you have any allergies? No? Fantastic. Okay. Are you left or right-handed? I'm left-handed. Great. And is there any reason I can't use your right arm to start your IV? No? Okay, great. I'm going to pull the curtain for privacy. And then if you'll give me just a second to get my equipment ready, and then we'll get started. Miss Pearl, I've noticed that I forgot something, so give me just a second. I'll be right back. I'm back. All right. Let's see. I'm going to put this tight band around your arm. So I want to look and see where a good place might be to start this line. So let me just see here. That looks great right there. Okay, get that tight band off. And I'm going to clean your skin with some skin prep here. A little bit of cold. I'll let that dry. Pearl, I'm ready. Raise you up just a little bit. There we go. Okay, here's that tight band again. Tight band. Okay. And a big pinch. All right. There we go. Okay. See if this is working all right. Great. All right. Hold real still for me. Put this on there. Alrighty. I'm gonna put some sharps. Okay, I'm talking to my examiner now, who says, okay, so now I'm me, not you. Okay? Because now the person that's me is gonna do this.
So
Okay.
we don't have to tape the actual IV cannula for the CPE. You know what I'm talking about?
No.
Where the IV's in, where you put the
That's what the Tegaderm's for.
Tegaderm over it.
You cannot have tape underneath
I'm not
the
under, I'm
tape.
talking about over top of it. You know, like to hold it
No,
down.
like to reinforce it. Is that
You don't need to. You need to secure the pigtail just like I have here.
Okay.
Are you talking about what?
Do you mean would it be wrong if you had tape like from this up here?
Well, like yesterday, when a lady started the IV yesterday in clinical, and she taped here afterwards, so it couldn't be pulled out. And I'm just asking. In CPE, that's it, right
But
there.
CPE, this is what we should do.
That's all I need to know.
I think we said put a piece of tape there if they were moving around a lot, just to help it.
But you also gotta think about skin integrity. You know, I hate tape on patients. I go in and pull it off of them. I mean, patients that have been in the hospital for a couple days, they got like 6 different things of tape or labs been in to stick them. I go in there and I take all that stuff off. But whatever. Okay. All right. So we ready for the next part? Okay. So, okay, Miss Pearl, I'm gonna start this IV piggyback here. This is your antibiotic that the doctor has ordered. So, give me just a second to get my equipment prepared, and then I'll be right back. Okay. Okay, time out for a second. The reason it looks like I wasted so much is because there was already liquid in this tubing. If it had been air, it wouldn't have looked like that. I just didn't want to make you confused. Okay. I'm going to make sure that these two are compatible, and they are. I could check in the drug book, or I could call pharmacy if I wasn't sure. I'm ready to put my gloves on. I gotta get my roller clamp or my alligator clamp on here. sequence. I'm just gonna make sure that I got this. Zero to all the way. And I'm gonna set my pump to 100 mils an hour. How you doing, Miss Pearl? Is that okay? That IV site seems okay? That's not bothering you at all? All right, well, it'll take about an hour for that to run in. So let me know if you need anything. Here's your call light. I'll put your bed back down low. Okay, so here I'm leaving the patient's room. I'm gonna document here that I gave this clindamycin. And then I would also write a narrative note in this patient's chart that I started an IV in her right forearm, a 22 gauge, and she tolerated it well. That's it. Done.